Hello viewers, welcome to Island Health You, a program designed to bring you matters related to health in Dominica. I am your presenter, Rima Alfred. This program will be brought to you on SAT TV this and every Friday. In this segment, we will take a close look at childcare from infancy to the toddler stage within the Roseau Health District. We received information from nurses within the maternal care department on the necessity of breastfeeding infants, immunization from infancy to toddler stage, as well as keeping children healthy between these stages. Stay with us.
You know I gotcha, this loving won't stop. And if you're hurting, baby, I will be your ice pack. Hey Dominica, this is Claudia and you're watching SAT Telecom.
From that moment after birth, mothers are advised to begin breastfeeding the infant as soon as possible rather than feeding the babies with formula. The reason for this is that the initial milk produced, which is referred to as colostrum, is high in immunoglobulin IgA, which coats the gastrointestinal tract of the baby. This protects the newborn until his or her own immune system is functioning properly. Nurse Florestine Lewis, EPI manager of Dominica, said infants should be exclusively breastfed from birth to 6 months. Absolutely nothing else should be given to the infant for this period of time. However, she said in cases where the mother has to return to work, milk expression and storage is recommended.
We encourage exclusive breastfeeding from birth to 6 months. By exclusive breastfeeding, I mean absolutely nothing else except breast milk. So no water, no juice, no bush tea, no anything, only breast milk. For working mothers, I know this can be a challenge in that they have to go back to work and then it's going to be difficult for them to exclusively breastfeed. However, we encourage them to express the breast milk and to store it on the fridge.
Registered nurse Chanel Elize, working in the Roseau Health District, who is based at the Newtown Health Center, had a small session with a group of mothers about how and when to express breast milk. They have been encouraged to store it properly in order to be used when separated from the baby.
That's why when you come to the clinic for the first time, we tell you to start expressing now. Mommy should express for 15 to 20 minutes at least 7 times in 24 hours. Her baby may sleep for 1 5-hour interval at night. So you can use a pump. The syringe is sort of a pump. It's a smaller version. It acts as a pump because you cut the nozzle of the syringe and then you actually pull back and forth like a pump. The pump is straightforward. Most pumps come with instructions on the box as to how to use it, right? But when you're expressing with your hands, what do? You have to wash your hands. Very, very, very important. You have to wash your hands. You have to wash the breast, right? You have to wash the instrument. Wash and sterilize the instruments very well.
After the baby has passed the 6-month stage, other foods should be added to their diet, such as pureed foods, soft cereals, water, and juices.
After the 6 months period is up, we encourage the introduction of food from the family pot. So that's where we begin our weeding foods. So we will introduce, small things like fruits, maybe crushed, or pureed foods from the pot for the baby, and the baby will have to be fed with a spoon. We also encourage cereals at that time.
The immunization process from infancy to toddler stage is seen as a necessity for the safety and proper development of children. Nurse Florestine Lewis said, vaccines protect children from the various viruses which they fight against within their bodies. She said from the inception of infant vaccination on the island to now, these viruses have either ceased to exist locally or are present in very rare cases.
Immunizations are very important. As you will remember, immunizations provide immunity to the persons receiving the vaccine. So what happens is that a vaccine is introduced into the body, and the body is supposed to respond by producing antibodies. So if the person comes in contact with what's the specific bacteria or virus for which we provide immunization, then the body is supposed to respond by producing the antibodies, which will help the person to fight against diseases. Those diseases are very fatal in that persons can die if they come down with the disease. You'll find for us in Dominica, we have not had cases, maybe our last case of measles, for example, was in 2000. And the reason for that is because we have maintained high levels of immunization consistently. And so we need to continue to maintain our vigilance and continue to provide the vaccines.
In order for proper development to take place, children should be nurtured and cared for from birth. A clean environment, proper health care including vaccination, well-balanced diets and vitamin supplements if necessary should be provided for the children. Nurse Lewis advised that parents read to the babies and sing to them, which will help them in their mental development.
Because babies are very susceptible to infection and to illnesses, and if their feeding utensils are not properly sterilized, they can come down with diarrhea and vomiting. And so sterilizing the feeding utensils, the bottles, the nipples and so on is very, very crucial. And it has to be done on a daily basis. Babies also, they crawl around on the ground, on the floor. And so we encourage tidiness and cleanliness, hygiene, very strict hygiene for the children. And we encourage you to put the child down on the floor, let the child crawl along and, develop in its own, its growth and development. But for that to happen, you have to have a safe area for the child, as well as keeping the appointments for clinic, because it's not just vaccines that you receive at the health center. When the baby comes, the baby has to be weighed, the baby has to be measured, the baby has to be given, the mother has to be given advice on nutrition and other aspects of the child's growth and development. You want a well-rounded child, we would encourage you to do things with your baby. So for example, sing to the baby, read to the baby, those kinds of things. All of that helps in the child's mental development. We want to encourage mothers, fathers as well, because we like when the fathers can come to the health center with their children to bring the children for the vaccine, because the only reason we have had successes in those areas is because we have maintained high coverages throughout the years. We all know that we are a global community, and those diseases can easily be spread from one country to the other. And if we lose our vigilance and allow our guard to drop, then those diseases can be re-imported into our island.
Island Healthview is supporting the EPI manager's message to the public to get babies and children vaccinated and protect them from viruses and diseases which may or may not lead to disabilities in children. And that's all, folks, for this edition of Island Healthview. Be sure to join us next Friday for another edition. Until then, I am your presenter, Rima Alfred. Thanks for watching.